urgent issues for public health right now are things that have come to the forefront around health inequities, for example. It affects whatever area of public health you're in, as we're able to better analyze how that issue plays itself out within different subgroups in the population. We're seeing that our population-based approaches have had a differential effect. Some people are benefiting more than others. And in our success at a population level at improving certain health conditions, we've inadvertently increased the gap between some subgroups. And that challenge of going back and trying to find out the balance between evidence-based population approaches and targeted interventions and focused attention for vulnerable groups is going to be the toughest challenge for us in the next few years.
I'm also, because I work a lot on the international side, I'm also getting to be kind of worried for the future about water supply, because we've worked very hard to immunize kids and do other things to reduce childhood mortality, but if they don't have water and they have droughts and they can't grow crops and the kids are starving, this is not a great future. So for me, that's beginning to look like a very big issue with climate change.
So I think the most important challenges we face are the sustainability of our ecosystems and the equity of our societies. And in both cases, we're in trouble right now. The long-term threats to public health because of the decline of ecosystem health around the planet is very, very troubling.
The growing obesity epidemic, children that, and when we think of the comparisons to even 20 years ago on the percentage of kids that are overweight or obese, the impacts that will have on their health. It really is, at this point, this could be, unless we're able to turn this around, this could indeed be the first generation to live not as long and less healthy than their parents. And that is more than a tragedy.
And I think that the big challenge for us now as a public health community around the world is to deal with the recommendations that come out of the World Health Organization's Commission on the Social Determinants of Health, which would take us back to the root causes of some of these issues, which are big challenges in social policy. For example, one of the chief recommendations of the Social Determinants of Health Commission report is to go right back to early childhood education and to invest in the well-being of the most vulnerable people in our population, the children. And the investment that is made at that level has tremendous payoff later on, but our challenge is to convince our politicians that early childhood education is a worthwhile social goal.
My biggest failure probably is to have failed systematically over the last decade to actually manage to get real attention paid to building more capacity in the public health workforce. Despite numerous opportunities and many attempts at it, I still don't really see that across Canada the public health workforce that this issue has really received full attention. It's obvious that we're going to be facing sort of waves of retirements over the next 10 years, and we're not, I don't think, planning adequately for the replacement of that retiring workforce.
We need to have capacity at every level, the local level, the provincial level, and nationally, to really change the environments in which Canadians are living, to address what are some of the most profound public health challenges that face Canadians, to allow chronic disease, whether it's diabetes, cardiovascular disease, cancer, obesity, to continue to ramp forward and not address the fundamental nature of those as preventable issues, preventable diseases, preventable challenges, I think lets Canadians down, and I think it's where public health absolutely needs to work.
So what I would like to see is us in public health working much closer together in things like the obesity area, the nutrition area, because clearly to have a healthy mouth, and you really do need a healthy mouth to have a healthy body, you need to eat properly, and you need to be aware through health promotion of proper oral hygiene and keeping yourself healthy.
There are other problems that have really gotten away from us, and one of them is, of course, tobacco. Now, a lot of people think, whoa, well, tobacco, we fixed that. We've got our law now, and we've got smoke-free places, and we've got this, and we've got high prices, and we've got this and that. It's not true. Tobacco is still far and away the biggest unsolved public health problem that Canada faces, even though the prevalence has dropped from 50% as it was in the mid-60s to just under 20% today. But a fifth of Canadians smoking, that's enormous. That's a terrible public health problem, and a lot of work remains to be done.
I think, however, particularly with the aging of the population, and the latest UN report has shown that within the next 2 years there will actually in the world be more older people than children for the first time. So I don't think we can ignore that, and the fact that with aging and living longer should be a great celebration. But we have to be more concerned about chronic diseases, about quality of life, about aging well and staying well.
There's one thing that towers over all others when we're talking about urgent problems confronting Canada at present. It's a problem that confronts the entire world, and this is the problem of global climate change, which is part of a larger problem of change going on in the world as a whole, biological change, ecological change, demographic change, economic and social change, cultural change. But climate change is the one that is going to do terrible damage to everything living on Earth unless we act immediately and purposefully and direct much greater resources, much more money, much more energy at it. Unfortunately, there are powerful forces, economic interests like the oil industry and other energy industries arrayed against this in much the same way as the tobacco industry was arrayed against the forces of public health and health promotion in the 1960s and 70s.
I think that the shift to the political right is already producing big problems and is going to produce bigger problems in that our social security net has already been weakened. That is going to continue to weaken, and I imagine that public health itself will be affected. We thought we'd solved, I'm not saying public health solved it, but we Canadians thought we'd solved the problem of poverty, poor old people several decades ago, and I think it's becoming clear that we didn't solve it, and that as our pension systems come under increasing strain, and I hope not collapse, we're going to have more and more old people again, and more disadvantaged people without the security net that we've had to support them over the years. It is apparently a truism that when we develop more of these social problems, it's public health that gets to pick up the pieces. So I think that's going to be a very substantial challenge for public health.